Hello friends, welcome back. In this video lesson, we shall be taking a deeper look at a case of emergency and intensive care by Dr. Michael Frass of Austria. The details of this case can be found in this reference, and you will also find this paper in the references section of this particular module. Dr. Michael Frass, as I mentioned in the earlier lesson, is the co-author of Homeopathy in Intensive Care and Emergency Medicine. And he works with the intensive care unit of the Department of Internal Medicine at the Medical University of Vienna. This is a serious case of food poisoning. It turned into a life-threatening situation, as we shall see shortly. This is the case of a 72-year-old female. She ate a small baked mushroom, a very innocent thing to do, and shortly thereafter, in a few hours, she developed symptoms which were so severe that she had to be rushed to a hospital after 9 hours of consuming the mushroom. Her symptoms were those of vomiting, diarrhea, and intense bowel pain. On the second day, her situation worsened. She was transferred to the ICU, and then she was put on a IV drip of Legolon. We shall be seeing at the properties of this drug later. She went into ventricular fibrillation and then she was defibrillated. Shortly after that, she lost consciousness. Continuing further, on the second day, she was thereafter intubated and put on the ventilator. She showed signs of cardiac insufficiency, so she was again put on a drip of epinephrine. Shortly thereafter, the medication was changed and then she was given norepinephrine due to tachycardia. Meanwhile, her blood was sent for analysis and they conducted a liver function test. The SGOT values, which are now known as the AST values, were very high, 450 units per liter, while the normal limit is between 5 and 40 units per liter. The SGPT, or what is now known as the ALT value, was 1070 units per liter, while the normal range is between 7 and 56 units per liter. Her normotest analyses showed 40%, whereas the normal values are between 12 and 20%. So as you can see, this was a very severe case of a condition which was approaching hepatic failure. Her condition continued to worsen and she came into a very critical state because she had acute renal failure. Then she was put on a continuous veno-venous hemofiltration, the CVVH, because her condition was not suited for a full-fledged dialysis. The surgeons realized that she required a liver transplant, but they refused to do that because of her deteriorating condition. So the doctors informed the relatives of the patient and said that her condition was so poor with very little chance of survival and that they should prepare for her imminent demise. So it was virtually a case that was given up by normal medical practitioners. It was on the third day at this particular stage that they decided to use homeopathic intervention. That is after the doctors had given up hope. Dr. Frass gave 5 globules of Arsenicum album 200 and repeated the dose every hour. They did this until day 5 when further deterioration occurred. Her SGOT value shot up to 2240 units per liter. The SGPT value also shot up to 6170 units per liter. The LDH went up to 4,800 units per liter. The normotest was 15%. The bilirubin was 12.40 milligrams per deciliter. So on day 5, they decided to change the homeopathic remedy. There was hepatic dystrophy, so they gave phosphorus 200C, 5 globules every hour. Shortly thereafter, the patient opened her eyes and she started responding to verbal stimulus. At this particular stage, the remedy was changed again because she went into a stuporous state. This time, the remedy was Helleborus 200C. Now thereafter, she started improving gradually. There was slow improvement between day 5 to day 20. Just imagine, just a few days ago, she was given up for dead. The SGOT level dropped within normal range. It came down to 10 units per liter. SGPT came to 32 units per liter. The LDH came down to 209. At this particular point, the patient was extubated. She was able to sit up in bed fully conscious, and she was able to eat and drink without any support. Remarkable. On day 27, she was transferred to the general ward. On day 34, she was released. She has recovered fully except for a minor hearing impairment. At the same time, there was another friend of hers who was her companion and had also consumed the same meal of mushrooms. She ate the same batch, and the genus of the mushroom is Amanita phalloides, also known as the death cap mushroom. She died on day 12. She was also admitted with the same symptoms, and she was dead on the 12th day. Whereas our friend here started making a steady recovery from day 5 all the way to day 20 till she was finally transferred to the general ward and was able to eat, drink unassisted, and went on to recover fully and was discharged. You will recall that on admission she was given an IV drip of Legalon. This is derived from a plant called Silybum marianum. The same plant is also known as Cardus marianus, and that is used in homeopathy. It has got tremendous hepatosupportive, liver supporting properties. They don't use the plant in the raw form when they prepare this particular medicine. It is rich with a flavonoid. This flavonoid is known as silymarin. It is given intravenously in such cases. It is supposed to block the receptors that bring amatoxin into the liver. And it has been prescribed and accepted and recognized by the FDA and other agencies in Europe as an antidote to this particular species of mushrooms which were consumed by the two ladies, one of whom died. To know more about this particular drug, you can consult the URL which has just appeared at the bottom of your screen. So friends, thank you very much for your attention, and we shall meet once again in another lesson. But I'm sure after this particular lesson, you must be convinced about how homeopathy can save lives in emergencies and in intensive care situations. So on that note, bye-bye and see you later in another lesson. Thank you.